Hi guys, it's Dr. Jen Caudle, and I'm back with the Be Your Own Doctor series. And I know you guys have heard in the news everywhere that Bernie Sanders, presidential candidate, presidential nominee candidate for the Democratic Party, has recently undergone a heart procedure and gotten a stent in his heart. So I know so many of you have questions about what is a stent, why do you need a stent, what's going on here, should I be concerned about myself? So today, we're going to break it all down. But before we start, guys, remember, if you want health news that you can use on a daily basis, or you want celebrity health news, or maybe you just want to know about that quirky health stuff that you've always just kind of wondered about, I'm your girl, as I always say. Make sure you click the subscribe button and hit the little bell to get updates. So let's jump right in and talk about what a stent even is. When we talk about a stent in terms of the heart, we're really talking about a metal sort of tube, okay, that serves to stent open, or keep open rather, an artery. Yeah, that's what a cardiac stent does. But let's back up a little bit first and talk about some cardiology, some anatomy, and all that good stuff. We're going to go back to med school for a second. Starting out with the heart, right? What does the heart do? It goes boom, 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 boom. Yeah, that's what we like it to do. It beats, and it helps pump blood all over the body, and it does so many amazing things. But the thing about the heart is that it's actually a muscle itself, and it's a muscle that needs oxygen in and of itself to be able to function properly. So, who provides oxygen to the heart muscle? Well, those would be the coronary arteries. Yes, my friends, the heart has its own specific arteries that wrap around the heart, feeding it oxygen and blood and things like that, so the heart can go boom, 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 right? You'll never forget this, and I know you won't, because of the boom. I know. Now, this is the thing, okay? The coronary arteries are just like arteries anywhere else. They can actually get blocked if there's too much plaque and cholesterol and all that kind of stuff, okay? Super important to keep this in mind. Segue for just one moment. You guys have heard of coronary artery disease, right? Or heart disease. Well, when we talk about coronary artery disease, we're talking about those coronary arteries. That's those arteries that supply the heart with oxygen so it can boom, 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 boom. Those coronary arteries can get blocked. We know that heart disease or coronary artery disease is the leading cause of death. Guys, it's super serious. So this is the thing. In the coronary arteries, if they start to get narrowed, right? You got the tube. And if that tube on the inside starts to get narrowed, what can happen here? Well, not a lot. Not a lot of blood can pass through that hole to provide oxygen to the heart. So what happens to us? Well, it's got to give us a warning sign. So we get chest pain. We start saying, oh gosh, oh. That's our body's way of saying these coronary arteries are getting blocked. They're getting narrowed, and we can't get the blood, the oxygen-rich blood through there. Okay, so if that should happen, right, we start getting narrowed coronary arteries, those really important arteries that supply our heart with oxygen-rich blood and help make our heart go boom, 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 boom. If they get narrowed, well, if we're lucky, we can open them up. And how do we open them up and keep them open? Well, we want to stent them open. It's kind of like a hose. You know when you used to play outside when you were a kid with like a water hose? What happens if you put a kink in that hose? Well, not much water gets through, right? Same thing with the coronary arteries. If there's a blockage there, not much oxygen-rich blood can get through. So with the stent, we're actually taking a little metal stent, little open tube, and we're funneling it through that we're funneling it through the artery to literally stent that artery open so it can stay open and the blood can travel through and supply the heart. So that's what a stent is. Now, maybe you know somebody that's gotten a stent, or maybe you've had one yourself. We know that about 2 million people get stents every year. Guys, that's huge. So this is a relatively common procedure that happens a lot, and people often do very well afterwards. There's not always a lot of downtime. Many of my patients who've had stents are able to kind of get up and get going relatively soon after they get the procedure. But don't let that, fool you in terms of its importance. It is so important, and I think in many ways it can be a wake-up call and sort of a message to us to really keep our bodies healthy. So how do you keep your body healthy, you're wondering? How do you avoid maybe having coronary artery disease or needing to get a stent or things like that, the best things that we can do are, honestly, guys, keeping a healthy weight, making sure that our blood pressure is controlled, that your cholesterol is within normal range, that your diabetes is controlled. That means taking medications if you need them. That means eating a healthy diet and exercising. It means not smoking, and cutting back on high salt foods and things like that. Guys, this is what's really important, to keep a healthy body. And not only will those things help your heart, but it's going to help so much more. So I hope this was helpful. Thank you so much for joining me. So if you want more health news that you can use on a daily basis, or you want to learn about that quirky health stuff, or maybe some celebrity health stuff, I'm your girl. Make sure you click the subscribe button and hit the little bell to get updates.